everyone, it's Kate Hildreth, and I'm back on The Rogue Millennial, which is a show here on the DailyClout network that focuses on all different kinds of cultural commentary, but also focuses on bringing you conversations and stories and updates that the mainstream likes to shy away from, stifle, and or keep on the down low. I'm online today with special guest, Dr. Kimberly Biss. Welcome, Dr. Biss.
Thank you for having me.
Great to have you. So Dr. Biss is an OBGYN in Florida, and she started collecting data on miscarriages and other maternal fetal issues when the mRNA vaccines rolled out. And she has lots of alarming information, which we're going to talk about today. In November of last year, Dr. Biss was able to share some of her findings before Congress, which I want to ask her about in a second. But before we dive right into this super important conversation, we have a quick message from our sponsors. Before we continue, I want to thank our valued sponsors for their support. First, I want to thank our partners at The Wellness Company. This team of renowned medical professionals, including Dr. Peter McCullough, Dr. James Thorpe, Dr. Harvey Risch, Dr. Drew Pinsky, and other truth-seeking doctors. They have crafted The Wellness Company's emergency kit, which looks like this. It's full of life-saving medications, antibiotics, ivermectin, you name it. It also comes with this guidebook, so you can kind of go through and see what each medication is for, what it's used to treat, side effects, all of that good stuff right in here. So this is the ultimate solution for preparedness. Don't wait for the next crisis to catch you off guard. Visit dailyclouthealth.com and use promo code KATE for an exclusive 10% discount. I also want to thank our partner at Charlize Skincare. According to the FDA, companies in the United States are allowed to market skincare products as non-toxic while still containing up to 49% toxic ingredients, which is wild. Those ingredients can actually make you age faster, disrupt your hormones, and may even cause serious illnesses. Charlize is an organic, toxic-free skincare line with zero toxic ingredients that is anti-aging and made with all natural ingredients. So stop supporting companies that are marketing you toxins disguised as skincare. Instead, reverse aging with toxic-free skincare from Charlize, made right here in the USA. Go to charlize.beauty and use promo code KATE for 25% off your order today. Please support DailyClout by supporting our sponsors. So this data showed that in 2020, the miscarriage rate was about 4%, and then it doubled in 2021 and then doubled again to 15% in 2022. Is that correct?
Correct. So they will tell you that the normal miscarriage rate is anywhere from 13 to 15%. I actually look back to my obstetric textbook, which granted was for many moons ago, but quoted the same statistic. But Naird and colleagues in 2020 actually showed the normal miscarriage rate's about 5 to 6%. And clinically, I've never seen that. It's always been lower than that. So 2020 was a normal year for us in our practice. Our miscarriage rate was normal at, rolling month to month average 4%. And then it went up by 100% or doubled the following year after the year, when the shots began. And we had a peak that November in 2021. And that's when I actually started collecting my data, because my biller came to me and said, Dr. Biss, we've had an extraordinary number of miscarriages this month. We had 8 in a practice that delivers 20 to 25 patients a month, is a huge number. And so that's when I started to track and went back and, did a deep dive, and then sent my data in November of 2022 to Jessica Rose, and she published it in her Substack.
So what were the logistics of compiling that data? Was it just, your experiences in the practice and then talking to other people in your same practice and compiling all those numbers, or how did that work?
Yeah, there was no talking to other people in my practice, because I'm the only one in my practice that hasn't had any of these injections. Mm-hmm. So I have access to all the patients in our electronic record, and I, by myself, went back into every patient's chart that delivered and, figured out, the data that I needed, because I was not only tabulating miscarriage rates, but also newly entering pregnant patients, because that went down from year to year, which is indicative of either they were miscarrying before calling for an appointment or they had problems with infertility now. So I was collecting that as well as the total birth numbers, et cetera. So it was very labor intensive, but I felt important because, this information had to get out.
Right. So what do you think is causing these miscarriage rates, or is that in your presentation you want to say?
I have some theories. Of course, nothing's been proven, but there's a lot of ways that this could be caused. I mean, we know that the lipid nanoparticles, which is the fatty envelope around the messenger RNA, goes to the endocrine glands primarily, but all over the body, and they focus very highly in the ovaries. So, that could be a component to it. We know that these shots cause clotting. So if there's microclotting in the lining of the uterus where the pregnancy is supposed to implant, that may perhaps cause a loss. And then very early on, there were scientists that were concerned that the spike protein has similar components to the syncytial layer in the embryo. The proteins on that layer. So if antibodies are made towards the spike protein, perhaps could be made towards now the embryo. So those are three possibilities, although those are just theories on my part. Nothing's been proven.
Wow. So have you had any blowback for speaking out about this when, there's a lot of, differences in the medical field right now and a lot of isolation of doctors who are speaking out. So have you faced any of that when you're talking about this?
Yeah, my chief medical officer of the company that I work for, she saw a video that Steve Kirsch had made of me that kind of went viral, and she, contacted me and basically gave me some crap about violating a social media policy, et cetera. And I told her, quite frankly, I don't think I did. I didn't even know we had one. And I wasn't on any of the properties of my company. And last I checked, we have a First Amendment. So she's kind of laid off. But I know that there is a file at corporate office with my picture in it. So they're keeping tabs on me.
How ridiculous. Oh my gosh.
Yeah. Mm-hmm.
Okay. So you have some data that you want to show us, presentation.
Sure.
So give me a minute. Let me pull it up.
I just wanted to show that the FDA has a classification of drugs when we're prescribing for pregnant women. And most of the drugs we prescribe fall in the B and C categories. There's a category X, which should never be prescribed for pregnant women if there's, no benefit, because we know they cause harm. And I would say that definitely these injections would fall under that category because prior studies on messenger RNA platforms that were done, the animals died in the trials, and most of the drug categories rely on animal data. So these definitely would be a category X. And prior to 2021, I mean, if we as obstetricians had ever prescribed a drug fresh out of the gate, I mean, that would be a malpractice suit. I mean,
Right.
We never do that. So if you want to scroll down to slide number 5, there's 2 drugs that we prescribed in our history that we should have learned from. One was diethylstilbestrol, which was a synthetic estrogen utilized to prevent miscarriage, and evidently it did not prevent miscarriage. But what we did find several decades later was the female offspring of these patients were at higher risk for malignancy, specifically cervical cancer. So these DES daughters, as they're known, are needing pap smears for their entire life to screen for that. And the next drug is on slide number 6, which is thalidomide. And that is a drug that was used to prevent morning sickness. Fortunately, we had a physician in the FDA with some credibility and didn't allow this in our market, in our country. But this drug primarily caused birth defects with the limbs. They were known as the flipper babies. And 40% of those babies died at birth. So if you go down to the next slide, this was what we were told, that we would get this injection and it would stay in our deltoid muscle, which is a joke. If you go down 2 slides from this one, next one. So this is the data that the Japanese obtained from the early Pfizer trials in their rats through FOIA requests, which showed the distribution of the lipid nanoparticles, which again, for your audience, is the fatty envelope around the messenger RNA. If you go to the next slide, I've highlighted, or it's not showing up, but it focused very highly in both the ovaries and the testes. Go to the next slide. This was an article that came out a year and a half ago, I guess, showing that fully intact messenger RNA was found in human breast milk. And then the next slide down is a newly pre-printed article. It's not yet in the publication, but they're trying to get in the American Journal of Obstetrics and Gynecology, which is known as our gray journal. And this shows that there's messenger RNA that's being transmitted through the placenta and has been found in the umbilical cords of these babies. So, obviously going to the babies. Next slide. This was a very good study done by Beth Pinellas, who's a high-risk obstetrician in the Houston area, that showed she studied women that were admitted with COVID. So they were both pregnant and non-pregnant. And she found with statistical significance that if you were not pregnant and you got COVID, you were more likely to die. So I think that there is something protective in pregnant women, and we're told the opposite, right? They're immunocompromised. If they get a respiratory virus, they're going to die. Had this information been out, maybe that could have helped us in our decision making on whether or not to inject our pregnant patients. But sadly, it wasn't published until 2022. But the study ended in April of 2021. Yeah. If you go to the next slide, this article came out last year showing there was not an increased risk in premature delivery or preterm labor, and women were told if they got COVID, they would be at higher risk of those two conditions. So that was not correct. If you go to the next slide, this is a classic example of how our literature is captured and deceiving. This is a prominent journal, New England Journal of Medicine. Tom Shimabukuro is the lead author. All the authors on that paper are government employed, work for the CDC, or are on the vaccine committees that advise the FDA. So completely not biased, right? So this was information that was gathered from the vSafe data. This was the app that women would, register any problems from the injections on. And they had a cohort of 827 women. They predicted that 13% of them had miscarriages, which is normal, which is not, I've already told you, that's higher than normal. But they didn't do the correct math because they used the whole cohort of patients as the denominator. And a miscarriage is a loss that occurs prior to 20 weeks. So you can't include somebody who's in the 3rd trimester in this calculation. So when critical people read this article like myself and did the correct math, the miscarriage rate was actually 83%, which I think is very similar to what Dr. Wolf has found in the Pfizer dumps with the early Pfizer trial data. If you go down a couple slides, that is the NART article I referenced with regards to the miscarriage rate of 5 to 6%. If you go to the next slide. So this is the meat and potatoes of what I presented to Congress. But this was my data that I collected from January of 2020 till November of 2022. And I sent that to Jessica Rose up in Canada, and she published a Substack that same month. So the first picture shows in the orange bars the representation of the average month-to-month miscarriages. So you can clearly see from year to year, these went up by 100%, doubled. In 2021 was 7 to 8%, 2022, 15%. Now my data stopped in November of 2022, but in December of that year, my miscarriage rate was 27%. And then in January and February of 2023, it peaked at 30%. And then it started going down and didn't get back to normal until June. So what's concerning is that I also went back and looked at all my pregnant patients to see what the vaccination rate was in my population. And it was 65 to 70%, which is commensurate with the Florida rates. And the majority of them had 2 and 3 injections. Very few had 4 or more. And they were done in 2021 and early 2022 for the majority of patients. And yet we were still seeing this issue occurring in the latter portion of 2022 and into 2023. So something was lingering there. Now,
sorry, question. So you said it peaked in January of 2023 and it didn't get back to normal until June, or like go back down until June. Why do you think it went back down? Is it because people are realizing that these injections are bad, or what do you think the reason for that is?
I think there's definitely, less of an uptake for sure. I mean, with this new booster, I think the uptake was only about 8%. Okay. So yes, probably. And I don't know, maybe it's because it's very remote now from when they got their initial injections. So the blue bars represent the newly registering pregnant patients. So first trimester pregnant patients calling for a new OB appointment. So we had the highest number in 2020, and 2023 had gone up, but still hadn't reached the number that we had in 2020. But at least it's trending up. But you can clearly see from year to year that number had gone down. And I don't think this was because of, I always joke, although it's not funny, climate change. I don't think people are, making the conscious decision to not get pregnant. I mean, the birth rate globally is down, and it's significantly down in certain parts of the world. So there's definitely something going on. Sure. If you go down to slide 21, that's the Department of Defense data, which showed, it's a very busy slide, but if you look at the upper right hand portion, you can see from 2020 to 2021, the significant increase in the number of miscarriages. And that is in a military population that's very healthy, and they have very good statistics. So that's amazing. If you go down to slide 24, let's see. So these are the other issues that I had not tracked with hard data, but had noticed had increased. So preeclampsia or gestational hypertension, which usually occurs in the 3rd trimester in a pregnant patient, was increasing, as was oligohydramnios, which is low amniotic fluid around the babies. Both of those conditions are due to poorly functioning placentas and causes us to deliver these patients prior to their due date and sometimes prematurely. The stillbirths, Dr. James Thorpe has a lot of data on the stillbirth rates around the world, and there are certain parts of our country where those were increased. Fortunately, I did not see that at my obstetric ward. I had analytics run, and our stillbirth rate didn't change. I didn't see any increased malformations with any significance, but I know that is an issue in some other parts of the country and the world. The increase in postpartum hemorrhages is really a concern. A postpartum hemorrhage is a woman that loses 4 liters of blood, which is usually 20% of a woman's blood volume. And that's on top of what she may have already lost from the birth. And these are usually managed with medications and maneuvers that we do, but these medications and maneuvers that we do and have always done are not working. So a lot of these patients are requiring surgery, and some are requiring hysterectomies. Wow. And I had to do a hysterectomy in August on a patient. Unfortunately, this was not her first baby, because that could be devastating, to a patient if she's not now, rendered not able to have a child again. But for reference, there are obstetricians that practice their whole career of 40, 50 years and never do a hysterectomy for that indication. So it's not common. So that's a concern. If you go down a couple more slides to 26, in my gynecologic patients, this is what I'm seeing. The breast cancer rates are higher, and it's happening in younger patients and also in patients that had breast cancers many, many years ago, and now they're getting a recurrence. I had one lady that went and got 2 Pfizer injections, and within a month she had bilateral breast cancer, and bilateral breast cancer is not common.
Oh my gosh.
The abnormal pap smears increased. I had my lab. We have our own lab in my company, and I had the IT people run the analytics. And from 2020 to 2021, it had increased by 15%. My theory is because if you recall in the VAERS data, a lot of people got these injections and broke out in shingles. Shingles is a resurgence of the chickenpox virus that we all have in our body if we ever get chickenpox. Well, in the gynecology realm, the virus of concern is HPV, or human papillomavirus. So my concern was that these injections were going to allow for the HPV to kind of rear its ugly head. So I made it an initiative to start going back to annual pap smears, because, the guidelines since 2011 were every 3 to 5 years in patients. And I decided to do it annually. And voila, my abnormal pap smear rate was truly increased as I had predicted it would be. Infertility is through the roof, and abnormal uterine bleeding, which includes, young kids bleeding prior to even puberty is supposed to start, reproductive age women with abnormal periods, and postmenopausal women that all of a sudden started bleeding, either after they got the injections or were around other people that were injected, which that basically is an example of the concept of shedding.
Right.
There is literature coming out now that is definitely a thing.
Yeah.
So if you go down to slide 30, this is Dr. Thorpe's data that he published, I want to say in 2022, basically showing the increase in the decidual cast shedding in women. Now, what a decidual cast is, if you can imagine, a period's normally 5 days on average. Imagine having that period in an hour, where the whole lining of your uterine cavity is shed all at once. It's very painful.
Oh my gosh.
And there's a lot of blood involved with that. And prior to them publishing this paper, there were 43 case reports of this in the literature in all time. And in their study, if you go down to the next slide, I think they had almost 300 women, 292 women complained of this. And they were not all vaccinated. Some were just around other people that had been vaccinated.
I did hear that, shedding, as we know, is real. There's evidence showing that now. But also specifically with sexual partners, right? So like if your sexual partner is vaccinated, there's like reports of women having, sex is painful and periods are worse and terrible like this. And do you think that's more the case with just general shedding, or like the specifically sexual partners who are vaccinated, who they're encountering and then experiencing this?
Well, when Pfizer was having the trials, they told the men if they were going to be sexually active. Well, first of all, they told them not to be sexually active, but if they were, to wear 2 condoms. So clearly they knew that this was something that could be shed in seminal fluid. Yeah. So I think it's a concern, especially if you have a couple where one has been, injected and the other hasn't. What do you do?
Right.
So Now, there's a newer article. If you go down to the next slide, this is another study that was published by Dr. Thorpe in the Journal of American Physicians and Surgeons, and it's in preprint, soon to be published, if it hasn't been already. But if you go down to the next slide, so I'm not a statistician, but how I understand this, he compared the rates of certain issues with the COVID injections to the flu vaccine.
Okay.
The flu vaccine from over 30 years' time. And the relative risks of these issues for each vaccine were, so you made a ratio, and that's what these, dots are. It's the ratio of those two.
Mm-hmm.
And according to the CDC, if you are above 2 for anything, that's flagging a concern, and that needs to be evaluated and researched. So if you look down at the bottom, number 1 is all the way to the left. The next bar is number 2, and every single condition on that graph is way more than 2. And not looked at, not questioned.
So upsetting.
So miscarriage, the menstrual abnormalities are the most, and then miscarriage is the next item. And then there's various other things listed there. So, this clearly never should have been given to pregnant women, anybody, in my opinion, but especially pregnant women. And, my concern is that, like in DES, this is going to be a multi-generational problem, because if these lipid nanoparticles go into female ovaries that are, female fetuses, when we develop, unlike men who regenerate sperm every day, we're born with all the eggs we're ever going to have. They're made by 20 weeks of gestation. So we may not know there's a problem until these women either don't get their periods, they don't go through puberty, or they can't get pregnant. So we just don't know, because no long-term studies were done.
Right.
And that's really the crux of my slides.
Okay.
But there is one more thing I wanted to address. If you go down to slide 39, it's a QR code that will link you to a Substack that Igor does. And he basically reads a lot of literature and crunches all the numbers. And he did a really good Substack on the new Abrevzo, which is the RSV vaccine. Mm-hmm. This is not messenger RNA based. It's more traditional. However, babies died in the trials, primarily from prematurity and being born, from preterm labor, resulting in a premature birth. However, the number was significant. GlaxoSmithKline was also producing this vaccine, and they saw this danger signal, so they decided to not market this, but Pfizer, of course, did.
Right, of course.
And when they presented their data, they only presented 100 people. So they said, yes, there were fetal deaths, but because the number is so small, it's not significant. So the FDA, of course, gave them the stamp of approval. So do absolutely not get this injection while you're pregnant.
So the other thing I wanted to ask you, kind of segueing from that, is how can, besides not getting the injection, how can pregnant women listening to this, what can they do to protect themselves and their babies, knowing what we now know about the effects on pregnant women, both through shedding and the injection itself?
Yeah, I mean, that's a tough question. I mean, if a woman is not pregnant and she has been injected, my recommendation is that she go on the flccc.org site, because they are treating vaccine injured patients, and they have protocols to get rid of the spike protein, which sadly, when you get these injections, you're turned into a spike protein making machine. And we don't know how long you're going to do that for. And there are people still 2 years out from receiving the shots, and they're still making an incredible amount of spike. So there's ways to help get rid of the spike protein with certain supplements, but there's also very cheap and easy ways to do that. One is intermittent fasting. We found if you fast for, like 16 hours, that helps your body to perform what's called autophagy, which is basically, programmed cell death, and it gets rid of the trash, so to speak, in your body, and it helps get rid of the spike protein. Mm-hmm. The other thing is to just, eat healthy food, not a lot of processed stuff, exercise, lots of vitamin D, and, maybe a weekly ivermectin, prophylactically. That's not going to hurt anything.
Right.
But until we do more research, we really won't know. And the problem is trying to get research approved and funded is very hard because we're going against the narrative.
Right. Understood. Yeah. Those are some really good points. And I want to thank you again for joining me to share this important information with the world. Where can people find you?
So the only place I'm on social media wise is Twitter or X, and it's at Doc Biss, so DOCBISS. And I usually try to answer questions when people reach out to me. So
perfect. Great. Thanks so much again for your time, Dr. Biss, and I hope you have a good rest of your day.
You as well. Thank you.
Thank you. Thanks for joining me on The Rogue Millennial. I'm Kate Hildreth. You can find me on the DailyClout network at dailyclout.io. I'm also on Getter and X at Kate Hildreth, and you can find my personal blog, Radical Reason, on Substack. Please subscribe to DailyClout. You can sign up for our free newsletter at the bottom of our homepage, or subscribe to our Best of DailyClout page on Substack so you don't miss important updates and interviews like this one. The best way to support us is by supporting our sponsors, the wellness company at dailyclouthealth.com and Charlize Skincare at charlize.beauty. Don't forget to use promo code Kate for a discount, and I will see you next time.